All right, good morning, everyone. Thank you for coming to the last installment of the Wellness Speaker Series that we've had this year. We'd like to announce Dr. Cole Ryan is here from Freedom Physical Wellness. He's going to be talking about balance and fall prevention today. It's a really important topic. I mean, all of you come to Stretch and Balance, Bones and Balance, and you're like, why is my balance not getting any better? So if me, Missy, and Vivian can help you, well, hopefully Dr. Ryan can. So with that being said, I'd like to turn it over to Dr. Ryan. Thank you.
All right. Great. Thank you, guys. Can everyone hear me all right? Everyone hear me? Okay, great. So like Eric said, my name is Dr. Cole Ryan. I am a physical therapist and owner of Freedom Physical Therapy and Fitness and Freedom Functional Wellness here in Naples. And today we'll be going over balance and fall prevention. Reclaim your freedom, because a lot of times what happens with our balance as we age, we feel like we can do less and less and less. And now we're restricting the level of activity that we're participating in, whether it's golf, whether it's bowling, or even socializing out on a Friday night, or even playing with our grandkids or our children or our grandchildren. So let's go ahead and dive into it. So I am a functional wellness specialist, Rocksteady Boxing certified clinician, TPI certified golf expert, personal trainer, dry needling certified, and of course a physical therapist. And my story, I've been married, thankfully, 3 years now to my beautiful wife here. So 3 years, I think every year's a milestone. But 2-year-old little girl, Brooklyn, and a baby boy on the way. So we're gonna have a boy and a girl. So super excited. Golden Retriever named Buddy, and then owners of Freedom here in Naples. So guys, reclaim your freedom. When I started my practice, one of my goals was to serve the community and not just be inside my walls. It's actually to break outside those walls, and that's why I'm here today. Because I want to be a dedicated servant of our community by improving quality of life and movement for all individuals. So that's why I'm here today, to break out in the community and give you guys all this good information. So objectives that we'll be covering today. I want to know a little bit about you guys. Well, we got a lot of people here today, but we'll just hear from a few. Really your story, why balance is important, the 3 main systems that help support balance, why balance naturally declines with age, the most common reasons people experience falls, and the simple strategies to improve your stability, your strength, your mobility, and practical things that you can do at home or out in the community. So your story, here are some talking points to help guide you, okay? So introduce yourself. If you're comfortable with this, have you fallen in the last 6 to 12 months? What are you doing as a result to prevent it? And why are you here today? Think of maybe how fear has affected your life and it's disrupted the things that you enjoy doing. So if I can get just maybe 3 or 4 hands, anyone that's comfortable to share a little bit more information about themselves. We have someone in the back there. That would be great. So like I said, introduce yourself and kind of go over these key points and really why we're here today.
My name's Karen Shorn. 4 weeks ago, I was taking stuff to the dumpster and fell, and I broke my wrist and had to have surgery. So now I find, and I used to walk, I'd walk a dog all the time. It was a combination of things. I had flip-flops on, there was a little crack, and there was a car coming, so I was looking up instead of down. But now, after this, I'm really nervous about, I feel like my posture's getting bad now too, because I'm constantly looking down. So,
Thank you. So we know why she's here today, right? We don't want to fall again and break our wrist. Anybody else? Anybody else want to share? Don't be shy. Any recent falls? Oh, yes.
I fell about a month ago.
Okay, let's go ahead and get the mic here on you. So, fell about a month ago.
He knows my story. I teach forms of balance here.
Okay.
I took a fall, and the good news is it was a bad fall. I didn't break my wrist.
Good.
I didn't break anything, I think, because for the past 6 years,
Yeah.
I exercise for bone builders.
So exercise, knowing how to fall actually is very important. Okay, how do we fall? So, you know, our lady in the back talked about a fouche injury, right, is what it's called, falling on an outstretched arm or hand. So that's how we end up with a broken hand or a broken wrist. So going over strategies that we can take at home or in our group classes, it's going to help improve our balance. Exercise, we know, is going to reduce our risk of falling as well. All right, so let's go over the first system, our vision, our eyes. So anyone that's wearing glasses today, obviously our vision's impacted even with that. So vision is what gives us feedback on where we're at in our environment, our depth perception, how far something is away from us, or how close something is to us. It utilizes visual references for balance and stability. I tell people you're really always looking at something, right? We're not, like, we may feel like we're blank staring, but we are looking at something. So there's always a point that our vision is focused on. So think about the depth perception. How are we processing the depth? So a little bit of the science is processed in the occipital lobe back of the head here. That's where that occipital lobe of the brain. So if you fall back and hit your head, we might have our vision affected as well. And it plays a key role in VOR. So that's vestibulo-ocular reflex. And we're going to kind of explain what that is after the next slide. So next system, our vestibular system. So this is a big one. They're all big, but this is a really big one because there's a lot of things that can go wrong with our vestibular system. So we have structures located within our inner ear, and they're made up of canals, and we have fluid inside of those canals. So take your level. You're out on a construction site. You want to see if something's level. You look for that little bubble to make sure it's in between those lines. That's what this system does for you, right? If I'm side bending and this is what's preventing me from getting dizzy is the vestibular system. It keeps me level and it keeps me straight because that fluid moves into the position it needs to. So this is where it gets really crazy. It detects head movements with your position relative to gravity, and then it kind of talks to your vision. And so that's how we end up with the vestibular system working with our vision to keep us upright. So it's, again, a key role in our vestibulo-ocular reflex. So if everyone looks at me right now, so everyone focus on me, eyes on me, keep your eyes on me, and rotate your heads to the left and right. Some of you guys are like, what am I doing right now? This doesn't mean anything. I just wanted to see how many people would do it. So no, this means everything. So this is the vestibulo-ocular reflex. This is your ability to maintain vision on me while rotating or moving your head. So this is where also something called vertigo can start, which some of you might be familiar with. So vertigo is true spinning sensation of the room. It's really a crazy symptom that can result from a condition called BPPV. This is benign paroxysmal positional vertigo. A lot of words there, but what it means is your vestibular system is not working correctly. So if I rotate my head to the right, or I'm getting up out of bed and I rotate my head, that fluid just feels like it keeps going and going because we have these structures inside that measure and that can sense the movement of the fluid. All right, so they're hair follicles really, and they can kind of sense how fast things are moving or how slow things are moving. So if you have any kind of disruption, it's going to feel like that room just kind of keeps spinning and spinning. So we have really we have a few different ways of treating it, but we have two conditions with it where the canal's affected or another structure within that inner ear called the cupula. So it's really where you've heard of the crystals, right, that kind of come loose and they become dislodged. And they become loose and they're just free floating out in the canal and they just can't understand the sensation. And so that's where vertigo happens. And so there are positions, there are maneuvers to reposition and put them in the right space. So that's the main, or that's really a big system, system 2. And then system 3 is proprioception. So this is the sensation of truly knowing where your body is and your extremities are at in space. So if you guys all know that your feet are underneath you right now, right? I hope so. We're seated. We know our shoulders are next to our heads. We know if I lift my hand up and raise my hand's overhead now. So that's proprioception. It seems kind of like minor, but it is a big system because it actually helps with our posture. So when we start to lose this, we start to lose our posture because we don't have that awareness of where our shoulders are at, where our hips are at, and all of those things. So there are different types of sensory receptors throughout the body, and they're really mostly mechanoreceptors. They're all over the place. They're in muscles, they're in tendons, they're in joints, and they're constantly giving the brain feedback on where I need to be at in space to keep myself upright or from falling, or how to navigate, maybe an uneven surface like walking out on the beach. So again, controls posture through strategies like the ankle, hip, and stepping strategy. So if I push you over, proprioception is what allows you to take a step forward to catch yourself, right? So if we have poor proprioception and I push you over, you might fall, or it might take you 4 or 5 steps to gather yourself. All right, so balance and age. What's the connection? Well, unfortunately, as we age, a lot of things deteriorate unless we try and handle the deterioration or we manage it. So I'll be honest with you, if you're lazy, you are going to age much faster than the guy or gal who's very active, who's out exercising daily, who's staying active in the community, whether they just go to things that, Cedar or anything like that. If you're not active, you will age much quicker. So balance requires an integration of our systems, the vestibular, the visual, and the somatosensory systems, which is the proprioception. Aging reduces the efficiency in how the brain processes the sensory input. So that's why it's very important to keep active, to stay active, because there's a process that occurs. Your brain starts to develop these new neural pathways, which is great because everyone thinks when a nerve dies, it dies. Well, that's not necessarily true. We can actually bypass those dead nerves by reestablishing new neural pathways. And we call that process neuroplasticity. So our reaction time slows, we have decreased proprioception, and it reduces our body awareness. The result, delayed or inaccurate responses to our loss of balance. So we fall, we trip, we're not able to catch ourselves. So let's kind of dive into what actually changes in the body. So there's white matter and gray matter in the brain. That stuff starts to deteriorate. Our muscle mass, our muscle mass declines by up to 8% per decade. So we automatically start to atrophy. Our muscles get weaker, and they just kind of go through a shrinking process. Our type 2 fast twitch muscle fibers decline. So I think this is a crazy statistic. There's a large percentage of people who stop sprinting after the age of 35. And so ask yourself, when's the last time I jumped? When's the last time I sprinted? Right. I don't remember that back that far, she says. So, for me, I have a lot of my patients jumping, doing this crazy stuff that you wouldn't even think is a possibility. And granted, you have to start somewhere, but it's developing the power. You could do 100,000 sit-to-stands, and you'd be nice and strong, but can you generate the power to actually stand yourself up, right? So it's not just the strength side of it. There's a power component too. So our decrease in visual acuity. So as things like glaucoma happen, cataracts, macular degeneration, things like that. So that is going to play a role in our balance. So keeping in mind that we have 3 systems. Well, one system starts to become compromised. Maybe let's use an example as our vision. Let's make sure the other 2 are really working well, right? So we can kind of make up for where we lack. And then, like I said, our vestibular system, it loses those hair cells and the ability to feel and follow that fluid movement. So that's why really, as we age, if we start to maybe just turn our head too fast, we get a little dizzy, is because the sensation and the sensation being sent to the brain is not processing efficiently. And then this is a big one I wanted to touch base on because I'm seeing it at record levels of people being diagnosed with Parkinson's. So Parkinson's, there are a few different things that cause Parkinson's, but a lot of times we see idiopathic Parkinson's. We're not exactly sure where it came from, but we have a pretty good idea that we're seeing it from environmental toxins. So I wanted to touch on it. So Parkinson's, we can have tremors, we can have stiffness, slowed movements, gait problems, and of course, postural changes. So you don't have to have all of these things, but you can certainly have some of them. Our symptoms result from a lack of a neurotransmitter called dopamine, all right? So when it comes to dopamine, I'm gonna get to what that exactly means, but this is a neurotransmitter that we start to lose over time. So our fundamental defect here, all right, you guys hang tight with me, all right? This is where it gets like kind of crazy, right? So stick with me, okay? The fundamental defect is we have this part in our brain called the substantia nigra, and it has a dark pigmentation to it. And what happens with Parkinson's is we really lose that pigmentation quickly, and maybe we lose almost all of it. And why that's important is because if we lose that, we lose the dopamine-producing cells, okay? So what is dopamine? It acts like a volume knob, right? So something's really loud, you're turning it down, you're turning it up. It helps with our amplitude of movement. So that's where if I'm lacking dopamine with Parkinson's, now you can see I'm not really reaching too far because I don't have that dopamine to tell me what amplitude movement I need. So it helps to start and stop movement. It scales the size of the movement and the speed of it. And then it actually helps suppress unwanted movement. So if we lack dopamine now, that's why we have some tremors, because it's not helping shut off those unwanted movements. So you can see here, bradykinesia, tremors, freezing gait. Bradykinesia is just like kind of a slowness of movement, okay? All right, so with all that being said, the good news is strength training helps reduce fall risk by 30 to 40%. That's a big number. And I talk to patients about this all the time because I love this. I'm like, you guys, you exercise regularly. And, I'll have the patient tell me, well, I try to. And I was like, okay, what do you do? I walk about a mile each day. I'm like, okay, great. What else do you do? Well, that's kind of all I do right now. And I'm like, so I love that you're walking a mile, but are you increasing your heart rate? Are you training the cardiovascular system? Are you doing any kind of resistance training? Because walking is not going to be enough. And I don't know that it ever is enough. Like, I'm going to walk to my car a little bit later, but that doesn't mean I just trained my body and I just used the systems in place to help me with my balance and my posture. So it's very important to I like to try and recognize, like, hey, are you drinking enough water? Well, I drink coffee. No, are you drinking enough water? Are you staying hydrated? Are you hydrating the joints? Whether it's in your hips or your back, right? Those discs, once they start to collapse, it's like a flattened pancake. You got to hydrate those. The inside of your discs are anywhere from 70 to 90% water. So you can imagine if you don't have enough water in your system, you're going to feel pretty stiff and rigid, right? And now your posture, you want to bend over because it helps your low back feel a little bit better, right? Now, are you resistance training? Well, I lifted a gallon of milk this morning. Also not good enough, right? So, 3 sets of 10, something that's challenging, that's going to use those muscles, get that blood flowing. All right, so our balance training, it enhances proprioception and neuromuscular control. So when we start talking about balance training, which I'm sure you guys are doing in your class, right? we're working on things that are challenging, right? If I'm not challenging you, then we're just maintaining that status quo. I've got to challenge you. I've got to we got to do things that are kind of difficult, because that's how you develop those new neural pathways. So obviously, all this stuff being said, it's combining the strength, the balance, mobility work, making sure you're stretching out your hips to make sure those are nice and loose, because if your hips aren't rotating, your thoracic spine's not rotating, your low back is. And I can show you guys a lumbar spine. It's really meant to flex and extend, right? So, if you guys are interested, any nerds out there, just like me, I mean, Google what a lumbar spine looks like. It's like side to side. It's not meant to really rotate, because then it blocks. It's meant to really flex and extend. We need the rotation from our hips and from our thoracic spine, especially for my golfers out there. All right, so let's talk about rock steady boxing, what that is, what that looks like. It's not necessarily just for Parkinson's, it's boxing. So what it is there was a young guy, actually in 2006, he was diagnosed very young with Parkinson's. He was a New York attorney, and he said, you know what, I've tried all of these things. I'm going to try boxing. So he really enjoyed boxing. He was going to boxing, I think almost every day, actually. It was like 4 to 5 times a week. He immediately got to work, and he began boxing with a trainer. Findings were that his tremors actually became more controlled. So a lot of times, especially with tremors that are just really out of control, or we're trying to manage them with medications, and I've seen this with medications, it seems like sometimes we have a difficult time getting that exact dosage, right? So boxing has been shown to actually help manage and reduce those tremors. All right, so hang tight, right? A couple of the research behind really what boxing does for you, and take this as just generalized exercise, not just related to Parkinson's, because all the time, as we age, we have smaller movements. I think another big one is how often are you lifting your hands overhead? I don't see that really too often. It's usually maybe I'll lift up and grab my gallon of milk or my coffee mug, but how often are you really going overhead here? How often are you looking up towards the sky, extending yourself, okay? So high amplitude movement, intentional movement matters with balance. So that's how we develop new neural pathways. That's how we really break the chains here and get that visual or that feedback that we need back to the brain. So boxing forces big deliberate movements. We're punching, we're stepping, we're rotating. These movements counter bradykinesia, which is the slowness, and hypokinesia, which is pretty much the suppression of movement. So repetition of large movements improves motor scaling, which is developing those big movements. And it carries over in our daily tasks, walking, reaching, turning. So balance and agility and postural stability improved. So take this outside of here, whether you have Parkinson's or you have fall issues, right? We're working on weight shifting, single leg stance, or directional changes. And the research actually showed an improvement in dynamic balance, which is what we do every day, actual balance through movement. So static balance is I'm standing still. Dynamic balance is I'm out moving out in the community, I'm walking on the beach, things like that. Helps with our postural reflexes. So we talked about the hip, ankle, and stepping strategies. And then it reduces our fall risk. Our aerobic intensity drives neuroprotection. So aerobic conditioning is we're using oxygen to support us. So there's anaerobic, which is like our fast twitch, our ability to sprint, perform the power that we need to stand up from a chair or a low-seated couch. The aerobic intensity or aerobic conditioning is me walking 18 holes of golf. That's going to be the aerobic side of it. So with that neuroprotection, if we elevate our heart rate within a target heart range for a period of time, we can actually help with the dopamine, all right, and improve that neuroprotection where we're not losing out on those cells and those systems. So improvement for endurance during ADLs as well, which is very important because I have people that tell me all the time, I just get tired getting dressed. So they have to like take breaks. Like I gotta put a shirt on and I gotta take a break and then I gotta put my pants on and I gotta take a break. So it's gonna help with things like that as well. All right, that was a lot. Deep breath. Okay, we're gonna keep it moving though. And we're almost finished, it's all good. All right, so this is actually not related. This is high intensity interval training. So you guys are like, what are you talking about, man? I don't want to do that. That sounds crazy. So high intensity interval training is not high intensity to me. It's high intensity to you specifically and individually. So, hey, you tell me, hey, this is kind of hard. All right, that sounds high intensity for you, okay? So high intensity interval training, after 12 weeks, 3 to 5 times per week, can reduce systemic inflammation and enhance antioxidant capacity in people. And really what we see here, the keywords slow aging and disease progressions. So why diseases happen is because we have this like systemic inflammation. Maybe we're only focused on once or twice a week. So another one is, well, you know, and I get this a lot, and I get it, we all got schedules. But people will tell me, well, I think I just want to start off with like once or twice a week. Okay, maybe for like a couple weeks. But if we want to make long-term, real changes, you can see here, this is calling for 3 to 5 times a week. I mean, we got core, we got upper body, we got lower body, we got balance, we got a lot of things to go through. We can't really get through it in once or twice a week, right? So I think that's the narrative that I like to break through on is once or twice a week is not typically going to do it. It's really that 3 to 5 times a week. You know, and I'm doing therapy with someone, they're like, I want to do twice a week. I'm like, I really want to do 3 times a week, but I know you got a schedule. But it's something that I think it's good to inform the community on what that looks like. So we should be doing some sort of exercise. So if, say you're doing resistance training twice a week, and then maybe you're doing cardio on your 3rd day or something. You know, you're doing power walking for 30 minutes. Increasing your heart rate. You know, everyone, I would say almost everyone, a lot of people got those smart watches now. You just pull up your heart rate real quick, see where you're at. All right, so tips for home. I was debating on if I was going to put this in here, but I'm a pretty straight up shooter here. You got to get off your butts. We got to do stuff, all right? Now, don't get me wrong, playing golf's great, but golf is not really exercise, right? That's a recreational activity. If we're increasing heart rate, that's great. But we got to do some resistance training. I mean, we really do. That's what anti-aging is, resistance training. So whether it looks like going to the fitness center, and if you're comfortable with what you're doing in the fitness center, great. If you're not, that's why we have group classes. That's why we have individual personal trainers. That's why we have physical therapists. So you have a lot of access to resistance training and what that could look like. And again, you know, if you don't know what you're doing, you know, work with someone because they'll help you. They'll help you with the percentages that you should be doing to challenge yourself. Set and rep ranges, because that can get crazy. You know, we can talk, you know, 3 to 5 sets of 6 to 8 reps or, you know, 12 to 15 reps. It kind of depends on what we're trying to accomplish. So there's a lot of science behind dosing exercise now. So I'll quick kind of go into that. So if I do a power clean, does everyone kind of know what a power clean is? It's kind of a quick movement. When we pull it up quick towards our shoulders. If we do a jerk, we do like an overhead or a up and then maybe an overhead press. So things like that. It's like I'm not doing like 10 reps on that ever. Like I'm doing maybe 2 to 6 reps. Right? Because it's the movement. It's not so much how much weight you're doing. So if I'm doing like a squat or sit to stands, I want to feel a little bit of that burn in my legs. Right? I want to feel that lactic acid kind of build up. Now you don't want to kill it because then you end up with that delayed onset muscle soreness. Maybe 2 or 3 days later, Eric knows what I'm talking about. 2 days later, those legs are burning. They're ripped up. So that's why dosing exercise is important. Because now you're really sore and you take like a week off. You're like, maybe that's not for me. So it's working with professionals, again, if you don't know exactly what that looks like, okay? So don't sit for long periods of time. I think, yeah, I'm still good on time. So, we want to try and get up and move at least once every hour or go through a positional change. I know sometimes, we're in a facility or a setting where we have to sit for periods of time, but it is good for the body to move. Sitting for long periods of time is not good for the back. It's not good for your posture, your strength, or anything like that. All right, so I'm going into some key exercises. I really try to think of 4 big ones that I could give to you guys right now, right here today, that you can take home with you. Sit the stands. Can you stand up? And I love that actually all these chairs, except for that one right there, lucky guy, they don't have armrests. What are we going to do? Can we stand up from this chair right now without using our hands? Yes? Okay. Now, can you guys all try it? Everyone cross your arms over your chest. Try to stand up without using your hands. Oh, there we got a little push. Cheater. No. Okay, you guys go ahead and sit down. So if you can't stand up without using your hands, right, we got some weakness in the legs. We got some poor power in our legs. Our single leg balance. What? You want me to stand on one leg? That's crazy. That's why we got countertops. That's why we got professionals to support us, to guide us, give us that protection we need, and that safety. Single leg balance, you do it at a countertop. Hold on to the countertop. That's fine. Let me just see if you can stand on one leg for 30 seconds. Right? You don't have to do it now. Sorry. You don't have to do that one right now. Do that one at home. We don't need anyone falling on each other, but so single leg balance, can you hold that position, even just standing with the countertop for 30 seconds? Oh, Cole, my hip's kind of starting to hurt. Well, we got some problems in the hip then, right? Because the hips play such a really vital role in our stability. Okay, so that's why we call it hip strategy. So ankle strategies for like maybe the beach or something. Hip strategies for like maintaining your balance, getting out of the car. Okay, so it's really the hips, the mobility, the stability that you have when you do things like that. That plays a serious role, especially when it comes to maybe hip pain or low back pain. How are your hips? Do you have an imbalance? Is one hip stronger than the other? I tested a patient today, actually. Right hip was significantly weaker than the left. 8 pounds difference, which you guys don't have to try and work that out. 8 pounds is enough for me to go, yeah, it's probably not good, right? We like symmetry to some extent. So the hip stability is very important. Tandem heel to toe walking. Could you pass this part of it, the sobriety test right now? Hey, excuse me, officer, I really can't do this, and I have not had anything to drink. Can you do a heel to toe walk for 10 to 20 feet? So again, take the countertop. Can I go heel to toe here for 10 to 20 feet and maintain my balance? Now, I'm talking about true heel to toe, not like none of this cheating where they're kind of offset, right? I'm walking a tight rope here, okay? And then look up at the sky. Even if you got some neck pain, man, try to lean back and look up at the sky, get that neck moving. How many can look up at the ceiling right now? We'll do this one. How many can look up at the ceiling right now? Okay, good. And I think, what we're seeing is we're seeing a lot of desk work. We're seeing a lot of phones and iPads, and that actually is playing a role in us losing our posture and our cervical stability. And I tell people all the time, we got to be able to move and rotate our heads. Otherwise, now we're moving our back, and now my back hurts. My back hurts when I drive. Can you turn your head? Normal range of motion for head rotations, anywhere from 70 to 90 degrees. Now you're thinking, whoa, that's like The Exorcist, man. And it's like, no, I should be able to turn my head and neck, almost 90 degrees here. Now, I see it all the time where it's maybe 40 to 50 degrees. We're driving, we're trying to look back, and we can't see because our head, our neck, everything's so stiff. And that's also going to play a role in our balance. So going through that dynamic balance, I'm walking down the street and Carol across the way says, "Oh, hey, Cole, how you doing?" I turn to rotate my head. Well, now I have to compensate because I can't rotate my head. And now I'm falling one direction. And now I trip over the sidewalk. Like things like that can happen in an instant. And we don't think about it. But you have to be able to move. You have to be mobile. And you have to have your balance in check. All right, so boxing tips for Holmes. Anyone that's interested in the boxing side of it. So I tell people buy a timer for 1 to 2 minutes, right? So you can do rounds, all right, where I do rounds for like 1 to 2 minutes solid. I take a 30 to 60 second rest break. I do shadow boxing, so improves coordination, it improves that proprioception. So if I'm here, I get in my fighter stance, I put my right foot back. So usually if you're right-handed, you're putting your right foot back. If you're left-handed, you're putting your left foot back. So orthodox versus southpaw. And so I'm working on maybe my 4 punches, a jab, I'm working on a cross, I'm working on a hook, or I'm working on an upper. And so I'll throw some combinations with that and move outside of your base of support, move outside of what you're comfortable with, okay? Because that's what's gonna help with that neuroplasticity and that neuroprotection, is moving with these large amplitude movements, none of this sissy fighting, because that's not gonna get you anything, right? I'm like, all right, break it up, step back from the heavy bag, reach for it. We don't want this sissy fighting because that's not going to do anything, right? We want to break out of what we feel comfortable with. All right, our dual task. So working our cognition, call out the punches. All right, I get a jab, cross, hook, upper. Go through that. And again, you don't need a punching bag. I mean, just go through it. Go through the movement. Take it nice and slow to start. And then get a little faster as you get more comfortable with it. All right, so our functional exercise, of course, like sit-to-stands or trunk rotations. Even going through some nice and easy trunk rotations here seated. You know, just keeping things mobile, keeping things moving, okay? And then our balance activities, again, like our single leg stance that we talked about. All right, so what to expect with classes. If you're not familiar with group classes or personal training or physical therapy or anything like that, typically I like to tell people, we want to do a testing day. We want to see what your baseline is, see where you're at. So I have a lot of tools that I use, and I'm sure maybe Eric uses some tools, or as a personal trainer, or the group classes use some tools. But really what we like to look at is, hey, let's get your 30-second sit-to-stand. You know, how many sit-to-stands can you do, good quality, in 30 seconds, right? And you guys would be shocked at what the normal range is, especially when it comes to the 80 to 90-year-old range. Women should actually be able to do about 11 sit-to-stands, unsupported, without using your hands. Men should be able to do 12 to 13 repetitions from 80 to 90 years old. So next one we can look at, if we can't do that many in 30 seconds, we do a 5-time sit-to-stand. So let me time how long it takes you to do sit-to-stand 5 times. And then we're going to try to drop that time down, or at least maintain it, right? At least maintain it, because none of us are getting any younger. All right, our FAB, which is our Fullerton Advanced Balance Scale. So that's something I use quite a bit. This is looking at a lot of dynamic balance, and really that stepping strategy we talked about, and also the jumping. You know, can you jump the full width or length of your foot? Can you do 2 full lengths of your foot? So think about, some of us maybe got some bigger feet here, I don't know. So you think about the distance, the length of your foot. Can you jump 2 lengths of your foot forward? Show us? Oh, okay. Just a broad jump.
Okay.
That's what we're looking for. Okay? Not bad, huh? I had a pretty good broad jump in high school. So, and it's crazy stuff like that you got, maybe you're just thinking, I can't do that. There's no way. There's no way. It's like I got a 75-year-old guy who just did it about 2 hours ago with one of my therapists. And now we're jumping up on 2 things. We're jumping up on the steps or a foam pad. Now we have some protection. We're holding on to them with a gait belt, right? But it's things that it's not out of the question, right? That really, when it comes to balance, I tell people it's like I want to challenge you, because if we're not challenging you, are we going to get the benefits? Right? You have to be outside of your comfort zone a little bit when it comes to balance. Okay? So we established a baseline designed by a professional, whether it's a personal trainer or a physical therapist. Record your goals. I want to accomplish what you guys want to accomplish. I got the same goals that you guys got. You know, I'll talk about getting up and down off the floor. You know, say you got grandkids. We got plenty of grandchildren, right? I mean, maybe they're 2 or 3 years old and they're just learning how to crawl or walk or what have you, and you want to get down on the floor with them. You're like, I don't know if I can get back up, though. So I can get down there, but can I get back up? And that's really like what we're trying to do. And what we're trying to change is we're trying to give you that freedom back so you can do the things you enjoy, you can interact with your grandkids and not feel like, hey, if I'm down there, I'm stuck. All right, so workout days, all of this stuff is specific to you and your needs. When we start talking about group classes, those are very important because I think the camaraderie in the group classes is what's excellent. It's knowing that you're not in this alone, that you have the support from your friends or your community members that, hey, you know what? I just saw Cheryl. I keep using the name Cheryl. If anyone Cheryl in here? Cheryl. So Cheryl, I saw Cheryl. She can get off the floor. Well, I want to be able to do that because I got a 10-month-old grandbaby. So I think that's where we can really push ourselves and push each other in those group classes. All right, so amazing, fantastic. That was awesome. Now what? All right, reclaim your freedom. So again, if you're not comfortable with doing this stuff, resistance training or balance on your own, you join a group. You go into a one-on-one setting. We're looking for expert guidance and support. Maybe the safety aspect of it. Or I'm like, man, I'm really, really uncomfortable with trying this balance stuff. You know, sometimes people will ask me like, hey, can you give me some exercises for my balance at home? And I'm like, I don't know if you should be doing this stuff by yourself right now because, we have high fall risks. And that's, really going through those testing days is how we can calculate whether or not you're a low or a moderate or a high fall risk. So if I have high fall risk patients and I'm like, hey, yeah, we should probably hold off on doing this stuff at home because it's really not safe to do right now. So we'll work on it maybe, 4 to 6 weeks. Let's just get a good idea on your comfort level, and maybe I'll give you some to do at home. Again, like I said, really the group settings, it's typically an all-around great time, right? We have that camaraderie, that accountability side of it. And then fighting it back against age, right? Age is just a number. I don't know if you guys saw, this was like viral. Eric, you may have seen it. I saw a crazy video like 3 months ago. There's an 84-year-old woman who was told that she would be sedentary and disabled because both her knees were just completely shot, right? They're bone on bone. It's painful even just to walk. And she's actually starting, I'm not by any means, but what I'm saying is she took action. She made a decision. She actually joined a CrossFit community, which is, whoa, I'm not saying join CrossFit, but what I'm saying is she started something. She worked towards a goal. And even in the CrossFit gym, work with someone that individually or specifically like, hey, this is where I'm at. I don't want to do 50 reps on a snatch. Like, I don't even want to do 50 reps on a snatch. But it's trying to find the right people, the right person, and have that accountability, the safety that's going to push you. But anyways, the 84-year-old, she's doing better than she ever has in her life at this point. She went back to her orthopedic surgeon, and he was like, this is incredible. I was like, he was like, you don't need knee surgery anymore. Keep doing what you're doing because it's working. She had no pain in her knees, but it's the movement, right? Motion is lotion. You've heard that? There's synovial fluid inside your joints. And when we just mobilize and get that fluid moving and stimulated, you're going to notice a difference. That's the lubrication. I love using car examples. It's probably because I got a 68 Chevy Nova in the back. That's mine, yep. So I've had that since I was 16 years old, and that's my baby, my daily driver right now. And think of, with that car, and this is a really good example, the transmission had went out for a period of time, and I didn't drive it for several years. So it was just sitting there. We get the transmission done and fixed up, and then I jump in the car, and now it's not running because I didn't drive it. So it's the same thing with the human body. And really that oil is our synovial fluid. If you're not moving it, you're losing it. 100%. And that holds true. So going through that range of motion, the mobility training, that's very important work because that's going to help stimulate and move that fluid around. And now we're drinking plenty of water, so that's good. So now we have really well-hydrated joints. All right, so consequences of inactions, our fall risk only increases over time. Right? I would say if I'm not doing anything, I'm only losing. Whether it's my muscles, whether it's my systems that help with my balance or my posture, fall risk is going to increase with time. So movements tend to get smaller, slower, stiffer. Balance can worsen, which of course equals higher fall risk. Our muscles weaken because they're used less. So think of muscle atrophy. It's like a deflated balloon, right? I just maybe did 3 sets of 10 on a biceps curl at about 15 pounds, and now my biceps are feeling pretty good. If I don't do that, they're just shrinking. They're atrophying. And then our ADLs, they take more time, more effort. Maybe I can't do them at all. Maybe I can't even put my socks on anymore because I don't have the mobility in my hip. And do not be sedentary because your balance depends on it. I would go even further. Your life depends on it. Okay, so I used to work in a skilled nursing facility here in Naples as well. And who do you guys think did the best when it came to rehab? Women. I love it. Women. The males stink. They're lazy. No, I was going to go with the people that participated. But I love it. Women. So the people that are participating, that are serious about, hey, you know what? I want to get from point A to point B. Point whatever in between is not good enough. So that's why setting goals for yourself is very important. And sometimes it's kind of hard for us to set goals. We're like, what do I want to be able to do? And the big one that I hear often, as you can imagine, is I don't want to have any pain. Well, that's great. But I don't want to have pain either. But we have pain for a reason. Pain is the body telling the brain there's something wrong. So pain is not always necessarily a bad thing. But why is that pain occurring? Okay, maybe we're stiff, we're immobile, we can't move, and then we try to move in a way that we can't move. And now we have pain. All right, so moving on, a few testimonials. Really, when it came to balance, so I work in a one-on-one setting, right? And then your group classes and personal training, they'd be able to give you the testimonials as well because we all have them. And it's very important to understand that these are real people having real experiences and real results. So, worried about falling. After a few weeks, and this is not like working on balance once a week, like I said, guys, is not going to do it. So if you're wondering why your balance isn't getting better, because you're only working on it once or twice a week. All right, so I want that to soak in. Like maybe we're not putting enough work in. So once or twice a week for balance, we're trying to train the nervous system. I'm not trying to get you stronger. I'm trying to train your nervous system. So it takes a lot more to develop this neuroplasticity and create those neural pathways than doing bicep curls for 4 weeks and being like, yeah, I feel pretty strong. So it takes several weeks. Balance and confidence improved, feel stronger, more stable, and they're back to doing the daily things that they enjoy without hesitation. And then for the boxing side of it, Really, so this is a good example. This is a grandchildren example. Not afraid of falling. They wake up excited to keep fighting, literally and figuratively, which is great. So I do like to use that literally and figuratively. You are fighting back against something, whether it's a disease like Parkinson's or whether it's just a fall risk. You know, you're fighting back against something. All right, so that's all I have for today, guys. Thank you so much for coming out. I really appreciate the attendance. I hope you enjoyed it. I mean, I hope you got a lot out of it.